Hi everyone, this is Richa and today I'm here with Tina. We are from IILT. So we are back with another OET role play today, and in today's role play we will be dealing with a concerned mother. She has brought her son along with her. So what happened is the son accidentally put a tiny stone in his nose and she's really worried about it. So Tina will be doing the part of the nurse and I'll be doing the part of the mother. So let's start?
Yes, of course.
So I hope you have prepared it.
Yes.
So you'll have 5 minutes to do the role play and you can start speaking.
Good morning.
Good morning.
My name is Tina Thomas and I'm the registered nurse working in this emergency department. I see you have brought your son and you're looking very worried.
Yeah.
How can I help you today?
Hi there, nurse. So my name is Susan and I have brought my son here with me. His name is Sam.
Okay.
So we were in the park and he accidentally stuck a tiny stone in his nose. So I'm really worried about it because it seems like it's worrying him so much there. So can you have a look?
Definitely, don't worry. So what I understood from you is that your son Sam has put a stone inside his nose, right? If you don't mind, could you please tell me in detail what has happened?
Yeah, so we were in the park as I mentioned earlier. So I was actually talking to my friends and Sam was playing with his friends. You know, that's normally what happens in the park. So they were playing there normally, but there were small pebbles on the ground, like tiny ones. So he accidentally picked it and I think they were playing by sticking it in the nose and accidentally it got stuck there. So I tried to pull it, but it's not coming out.
It got deeper inside,
yeah,
right?
I guess so. And he's actually crying a lot when I tried to do that too. So I don't know what to do. So can you please have a look?
Definitely, I will have a look. And one more question to you.
Sure.
Did he face any difficulties at that time?
He has been crying throughout, so I think it's paining for him. He didn't complain about anything else.
Anything else? Okay, don't worry. You have brought him to the right place. Let me just examine him.
Yeah.
Okay. Okay, so after the examination, what I have found out is that the stone is stuck inside his nasal cavity. Nothing much to worry. With a small, simple procedure by using a tweezer, we can just remove it off.
Oh, a teaser?
Yes.
I don't think that's a really good idea because no offense, but I am really worried about Sam's health and putting a teaser in his nose will be a little awkward for me. So can you please call the doctor? He can come and assess Sam and he can give his advice.
Definitely, the doctor will be coming to see Sam, but first I need to prepare for the procedure, okay?
Yeah.
And then, and it's actually tweezer is the best procedure that we can do, that is by using a tweezer, because it is just stuck in his nasal cavity. So it's not gone much more deeper inside. Otherwise, then we need to use a scope or something like that. And that will be more difficult for Sam, right? So a tweezer is better option because it's still there. We can just pull it out because it is very well evident over there. And I've already informed the matter to the doctor, and the doctor will be coming and he'll be doing the needful. How's that sound?
When will the doctor come? Will it take a long time?
Yes, the doctor will take around 15 minutes to come. By the time we will just arrange for everything, and I'll keep him in a proper position so that the doctor can come and do it as soon as possible, and then we can, he can be free from this problem. Yeah?
But I don't think 15 minutes is a bit longer. Can you please tell him it's an emergency
No, we have
case?
already told him because already he's attending one patient who's having a who went through a cardiac arrest, so he's looking into that patient. So as soon as he finishes with that work, he'll come over to Sam and he will do things appropriately. Yes? Okay?
All right, okay, fine then.
Okay, so once again, do not worry. We have come to the right place and we are here to help him out. So let me reassure you once again, tweezer is the best procedure that can be done so that the stone can be removed off easily and he'll be fit and healthy when you take him back home. Yes?
Can I ask you a question then?
Yes.
If you use a tweezer to pull out the stone from his nose, will he have any pain or any bleeding after that?
Actually, because the stone got stuck inside his nose, as we pull, there can be a slight bleeding for some people. For some, they won't even have a bleeding. And as it moves them, sometimes inside the skin there can be some rough and tear that can happen inside. But we're going to give him an antibiotic, we're going to give him an ointment, and we'll be giving him a painkiller too.
Okay.
So the first one day, just see that you do not make him sneeze or do not make him strain much. And sometimes even he can have a small hoarseness in his, sound. Okay. So other than that, nothing else to worry. This is a very small foreign body that has got clogged inside his nose, and we see this often day by day. So nothing much to worry.
Yeah.
And your son will be fine.
Yeah,
okay?
I hope he is.
Yes, definitely he will be. Anything else to ask?
That's all. I just want him to be fine. That's
okay,
all.
so let me just prepare Sam for the procedure. Thank you.
All right, that's all. Okay, so by that we have come to the end of this role play. Hope you guys enjoyed it, and you really did a good job.
Thank
Especially
you.
when it is concerned parents, it's a very troublesome area, right?
Yes,
because
yes.
they will have a lot of questions. They will be so concerned about what will happen to their child.
Yeah.
So she did a really good job. So like you guys know, we'll have a feedback session after this. So we will straight away get into that.
Okay, yes. We'll see you in the next role play.
Thank you. Hi everyone, this is 𝗥𝗶𝗵𝗆 from IILT. So we just now watched a video where a 3-year-old boy was brought to the emergency department by his mother because he accidentally stuck a stone in his nasal cavity. The mother is really worried about the entire situation because she tried to pull it out but she couldn't do it. So she brought the son to the emergency department, but the problem here is she doesn't want the nurse to do it. Rather, she wants the doctor to do it. So let's see how we can break down the entire situation using the keywords and present it. Let's get started. So let's look into the first task. So here the first task says, address the concerns. So we do not have much to do here because this is an emergency department and the first task is simply asking what are the concerns. So you can just start asking the question like how can I help you or how may I assist you here after you introduce yourself. So here nothing much to do because it's a very simple task by addressing the concerns. Now let's look at the second one. Enquire what exactly happened and the symptoms faced. So what are the keywords here? There are two segments here. The first segment is we have to check what happened, and the second segment is we have to check for the symptoms. So let's see how we can create a sentence here. So before we do that, you have to connect to the previous conversation. That is where you ask for the concern and the mother is telling you the concern. So before you get into task number 2, what you have to do is you have to relate to the previous conversation, okay? So before you ask what happened, you can just console her by saying, don't worry, you have reached the right place, I will take it from here. But before proceeding further, I would like to ask you some questions. So could you please tell me what exactly happened? See, this is the way you can do the first segment of task number 2. So here she will give you an answer about how it happened. Okay, so after you listen to that, the next thing you have to do is ask for the symptoms. Enquire about the symptoms. You can simply ask, what are the symptoms he experiences? Okay, so these are the two ways how you can do task number 2. First, you have to check what exactly happened, and after that, you have to check for the symptoms. Okay, so now let's look into task number 3. Console the parent and offer to examine the child. So like we've seen in task number 2, here also we have two segments. The first segment is we have to console the parent, and then we are going to examine the child. So how we can console the parent here? So here, as I mentioned in the beginning of this video, it is the parent is really worried and she doesn't want you to do it, she wants the doctor to do it. So she will be in a hurry-burry there and she will be really concerned. She'll be showing all those expressions and emotions there. So how will you do that? Okay, so you have to use a very strong and convincing reassurance statement there. So you can say that, do not worry, as a mother I understand that you're going through a very difficult time right now, but please be relaxed, okay? Let me examine your son. So this is how you can convince the mother in this part. Or else you can even go through a very different acknowledgement statement by saying that you have reached the right place, we are well experienced and trained to handle situations like this. Please be relaxed. So in both these cases, what I'm doing is I'm providing an extra support, or I'm reassuring the mother that where she has come is the right place. So there is nothing for her to be worried about. Okay, so this is how you're going to do task number 3. So let's look into task number 4. Inform the parent there is nothing to be worried about. In brackets, tiny stone stuck between the nasal cavity. So here what we are going to do is we are going to explain what we found during our examination, right? So if you relate to the previous conversation, which is task number 3, you can start task number 4 with an acknowledgement to what you discussed in task number 3. Okay, so I'll show you guys how to do that. Before that, let's see what are the keywords you have to pick in task number 4. The first one, nothing to be worried, and the second one, tiny stone stuck between nasal cavity, which is the information given in the bracket. So let's see how we can create a sentence here, okay? So before we get into this sentence construction here, let's relate to the previous conversation, okay? So in the previous conversation, we examined the child, so that is where we are now, okay? So as an answer to that, you can start your next task by saying, based on my examination, I can see that there is a tiny stone which is stuck between the nasal cavity. There is nothing for you to be worried about. See how I actually merged these two keywords, that is nothing to be worried about and the tiny stone in the nasal cavity in this sentence. This is how you can do it. Now, when I connected to the previous conversation, what happened here is that my connectivity between the entire conversation also improved. So this is how you can use connection between the previous conversation to have a continuous fluent conversation throughout, okay? So now let's see the task number 5. When the parent is reluctant to let you take the stone out, inform him or her it is a simple procedure, okay? So now if you look into this particular task, the keywords are reluctant, you take the stone out, simple procedure, okay? So the first segment which I said is reluctant. So it is actually emotional state of the parent. So you are supposed to actually convince the parent here by saying you are well trained to do it. And then you are saying that you can handle it by yourself. You have done it in your previous years of experience or something like that. And then you're also saying it's a very simple procedure. So let's see how we can do this particular task. So you can say, before the task number 5, before you get into it, you can relate to the previous task where you're saying that there is a tiny stone in the nasal cavity. So you're as a continuation of that, you're continuing the task number 5. So you can say, which can be easily removed. You're telling there is a tiny stone in the nasal cavity, but don't worry, there is nothing to be worried about. So with your permission, can I remove it? Okay, maybe you will finish like that. And as a continuation of the last part of task number 4, you can start task number 5 by, I understand your reluctance. Okay, but let me assure you that I am well experienced to remove this stone because I have seen many cases like this in my years of experience, okay? And it is a very simple procedure. So there is nothing for you to be worried about. So this is how you can do task number 5. So task number 6, explain that a tweezer can be used to extract the pebble from his nose, in brackets, painless. So here, when we see task number 5 and 6, we can see a similar nature, right? In task number 5, we are speaking about a simple procedure, and in task number 6, we are saying how to perform that procedure by using a tweezer. So it's kind of like having a similar nature, so you can club it. You can club task number 5 and 6 together, okay? So in task number 6, the keywords are tweezer, pebble from nose, painless. Okay, so these are the keywords in task number 6. So I mentioned that you can combine task number 5 and 6. I'm going to show you how you can do that. So as an end to task number 5, I said it's a very simple procedure and you do not have to worry about it. Okay, I will use a tweezer to extract the stone from his nose, and I assure you that it is a painless procedure. Your son will not even experience a slight pain. So this is how you can combine task number 5 and 6 because it has the same nature. Okay, so the last task. When the parent is still adamant, inform the doctor will be here soon and will do the needful. So we can see that towards the end of the role play also the mother is not being convinced. She is not letting you do it. She wants the doctor to do it. So we cannot force a patient or a bystander, too many times. So you can try to convince them maybe once or twice or even thrice, but don't go beyond that, okay? So here the keywords would be adamant, the doctor comes soon, will do the needful, okay? So there you can say, you can ask a name. So say for example, if the parent's name is Miss Susan or something like that, you can use the name and say, Miss Susan, I understand that you're really worried about your son and you don't want me to do it because you think that it might cause some pain or some discomfort for your son, but no worries. I will make sure that he's all right and I will inform the doctor very soon and the doctor will come here within no time and we will do the needful for your son. Will that be okay? It's as simple as that, okay? So this is how you can do this particular task. So we now saw how we can break down each task and pick the keywords to connect it and create a new sentence from it. Okay, so I hope this was helpful for you guys. If yes, please let us know in the comment section, and I'll see you guys next time. Bye bye.
IILT, it's my cup of tea.